Switching from Suboxone to Sublocade is actually pretty straightforward. At the pharmacologic or biological level, you're still getting the same buprenorphine, the active ingredient in both Sublocade and Suboxone. So it's basically the same medication. You're just changing the delivery method for the buprenorphine. But from a logistical perspective, there is an important requirement according to the FDA. A patient has to be stable on Suboxone or another sublingual version of buprenorphine for at least 7 days before starting Sublocade. So let's say you're struggling with opioid addiction and you decide to get off and you really want to do Sublocade, the injection, instead of Suboxone. What this means is after you stop using opioids, you still need to transition onto Suboxone first. You have to be on Suboxone for 7 days. Then on day 8, you can stop the Suboxone and receive the Sublocade injection, which lasts for 1 month. Here are some factors to consider if you're thinking about switching from Suboxone to Sublocade. Convenience in terms of time. Sublocade's a monthly injection versus Suboxone, which is a daily sublingual medication. 2, convenience in terms of physically going somewhere in person. With Suboxone, you can get it prescribed through telehealth, though you do have to go to the pharmacy physically. With Sublocade, you definitely have to go to a clinic in person. Unfortunately, we can't administer Sublocade virtually. 3, cost. Depending on your insurance, Sublocade generally costs more than Suboxone. 4, needles. If you don't like needles, obviously Suboxone's a better choice. 5, taste. If you're super sensitive to certain flavors, you might prefer an injection instead of taking a sublingual tablet or film. So overall, switching from Suboxone to Sublocade is fairly straightforward. There are some factors you should consider, and you can decide together with your healthcare provider.